Now we're going to talk about different levels of hospitalization.
So Affiliated Pet has 3 tiers of hospitalization, and those can be found under treatments. So we're going to click on the treatment list tab, and under find we're going to type hospitalization. That's going to bring up all of our hospitalization codes. You'll notice that we have full day and half day codes. Standard care hospitalization is going to be used anytime we have an animal in the hospital and it's just sitting in a cage under observation. There's no IV catheter placed. There's no treatments that are being performed other than TPRs and feeding and walking outside. This is a pretty basic hospitalization charge. Anytime we have an animal with an IV catheter in place, that animal gets charged special care hospitalization. Having the IV catheter in place makes us have to flush the catheter every 4 hours if they're not on fluids. If they are on fluids, it requires us to make sure that the pump is pumping the fluids in accurately and appropriately based on the rate that we have set. We also have to make sure that the IV catheter is still patent and functioning properly and not needing to be replaced, or not making the pause swell because the tape is too tight. So that is when we charge for special care hospitalization. Also, we would charge for special care if we are administering medications over the course of the night or having to perform other treatments in the middle of the night as well. Intensive care hospitalization would be charged for anything that is intensive in nature. Animals that get put into the oxygen cage, anything requiring a blood, plasma, or antivenin transfusion. Those are all examples of when hospitalization intensive care should be used. Anytime a emergency estimate is signed by a client, it's safe to say that that patient is also going to be charged for intensive care hospitalization, but that can be left up to the doctor's discretion on shift. Not every time we get an emergency estimate signed means that it's going to be an intensive case overnight. So that's going to be a judgment call with the emergency estimates. But general rule of thumb would be anything that gets put in oxygen or anything receiving blood, plasma, or antivenin, or animals that are getting serial ECGs overnight and that sort of stuff, that would all be considered intensive care hospitalization. We would use the half-day hospitalization charges in the event that the animal's been here over the weekend and they haven't been here quite 24 hours for that second day of hospitalization and they're going to be discharged. We would then charge the half-day if it hasn't been quite 24 hours since they got here for the second day of hospitalization. Or if a patient, for some reason passes away, we would charge that if it hasn't quite reached its full day of hospitalization yet. But that would be the only time we charge for half-day hospitalization charges. And that is how you would charge for. That's how you would select hospitalization based on what's presenting and what's being hospitalized.